Hello, Green Spring. We're back in the studio, and now I have with me Christine VandenDries, Home Care Administrator. Good morning, Christine.
Good morning.
What do you have to tell us today?
So I figured we'd talk about the difference between the two departments that I manage.
Which are?
Home health and home support.
Yes, I think we always, or some of us always wonder, what the heck is that and what is
the
what?
difference? We have home health, which is a Medicare paid for, private insurance paid for service you can get ordered by your physician when you have had an acute illness, a recent hospital stay, surgery, or if you're just declining and you're not making it out of your apartment as often and you really can't get to the medical center or outpatient rehab, you just can't physically do it, or if you can do it, by the time you get back, you're so exhausted you have to nap for 2 hours. It really makes you home health appropriate. So we can bring nursing, and under nursing we can bring wound care, medication management, basically any kind of disease process that might be new, teaching you how to give insulin injections, or if you have to give blood thinner injections after a surgery, we can come do those and teach how to do that.
So those are nurses who come to your apartment then?
I have 2 RNs and 1 LPN. They've all been here with the community for a long time and are very experienced.
Who are they?
We have Donna Galeas Umana, who is our LPN, and she used to work with hospice, home support, and home health. We have Stella Beeson, who's been with us since about 2012, and she's our lead RN right now, and she opens most of our cases for home health. So anybody that comes under home health with nursing will see Stella for sure. And then we have Cheryl Morway, who is an RN with lots of experience. She works mainly like 1 day a week and kind of flex on the weekends here and there. So we have those 3 nurses. Plus we have nurses in home support that occasionally come over and help out, because the business is, although nursing is nursing, the paperwork is so different when you get the government involved with Medicare. So having to train those home support nurses to do all of that paperwork for home health is very different. But we have a couple that come over and help occasionally.
And obviously those services are also available on the weekend.
We are, so we can start cases on the weekend, whether it's nursing or physical therapy. Those are usually the 2 that we can start a case with. And we can do those services on the weekend. If there is an urgent need on the weekend, if someone has, for example, a catheter and it comes out, we have on-call nurses on the weekend that can go out and replace it, contact your doctor, and get done what needs to be done.
But it all starts with your doctor. Your doctor sends you home and says, I don't think you should do this on your own, or something like that?
Yeah, you need a little more support, or you need some healthcare assistance. See, there's a technical skill that I'm not comfortable with you handling, like a catheter, and our nurses come out and start for you. Sometimes the doctor will order physical and occupational therapy as well. Sometimes the nurse gets in there and sees that there's an issue and says, I actually think you need PT and OT. I'm going to call your doctor and get that ordered for you. So then physical and occupational and speech therapy can come to your home as well if you're not able to get out.
Okay.
So, we also offer a home health aid under home health. Not the same as home support, so our home health aid visits are very short and focused, usually no more than an hour, really meant for personal care. Working in tandem with that occupational therapist, they create a care plan for the aide to execute 1 or 2 times a week. For bathing, grooming, they always have to clean up after themselves. Whatever they use, they have to clean up. They can start a load of laundry. Usually they can change a bed if there's a need to do that. But they don't do cooking. They don't do escorts. It's very, very focused under Medicare guidelines. But we also offer that as well. And it's meant to short term kind of get you back to your baseline so that you can start caring for yourself again.
Yeah. And it's paid for by the insurance, you
said. It is. Medicare cover.
All of it? Most of it? Some of
Regular it? Medicare A pays for 100% of our services as long as they're deemed medically necessary. So our nurses are very good at analyzing the situation and ordering what's appropriate. So
and that's why all that paperwork.
Yes, exactly why.
Okay.
Yes. Now, if you have private insurance for some reason, there occasionally is a copay. I've seen a 10% copay for certain ones, but most of our residents have either Medicare or a Medicare Advantage plan.
Yes.
And that usually provides full coverage.
Okay.
Yeah.
So that's part of you.
That's part
That
of
is,
me.
and that was called home health.
Certified home health.
Certified home health.
Yes.
Okay. And now
The other part of me is home support.
Yes.
Home support is a private duty agency, is the easiest way to think about it. It's
okay.
a private duty care agency.
Who is already on campus.
We work on
it's
campus.
Not like someone who has to come from the outside.
Right. So we are all Green Spring employees there. We do not use contract staff. We are licensed, bonded, insured, which is really important when you're inviting someone into your home. All of our staff go through a pretty significant training period, both with our clinical managers and then with a preceptor in the field. And they're subject to annual skills fairs and kind of checkups they get, supervisory visits and things like that. And they can come for as short to your home to provide personal care as short as 2 hours or as much as 24 hours.
So is that the minimum, 2 hours?
2 hours is our minimum now.
Because I remember it used to be a lot shorter.
It did. I think at one point in time
it was
it might have
15
been
minutes.
15, then it was 30, then it was an hour. Erickson as a whole in the home support department did a lot of surveys and looking at residents' care plans and what we were trying to do in that 1 hour time frame. And it really wasn't enough time to provide appropriate care.
Okay.
You know, talk to our residents that we're caring for and not just be working only, and still clean up and get, you know, documentation done. So we have a 2 hour minimum now.
So even if you are quite with it, but you need somebody to fill your pill boxes, which wouldn't take 2 hours, it'd still be 2 hours.
So our pill box filling is done by our nurses in home support. They come out and do that as part of their care plan. And then we have medication reminders where we can send an aide to your apartment just to remind you to take your medication. And those visits are different from personal care. So medication reminders can, you know, usually about anywhere from 15 to 30 minutes just to make sure, let me get you a cup of tea to take your medicine, make sure you take it, make sure they do the documentation. So that medication reminder and our escort services are not subject to that 2 hour. Yeah, those are not subject to the 2 hour
I'm
limit.
glad I asked.
Yeah.
Okay.
So we have our aides in home support and we have our nurses. So we have 3 full-time, a part-time, and 1 kind of flex nurse that work in home support. And they will come out and do things that Medicare says home health is not appropriate to do. So if you need help getting on compression stockings, or if you need wound care that's not considered skilled by Medicare, if a doctor says put bacitracin on that and wrap it and change it every day, but it's in a place you can't reach or can't see, that's when home support nurses are more appropriate. If you don't have family or friends to help you with that, our home support nurses can come do that for you.
So it's something that a nurse should do, but it's not something Medicare will pay.
Right, so a nurse can do, a family member can be taught, but maybe there's just no one available to do that. So home support nurses can do that. They also administer medications that the nurses do that might be difficult to administer. An injection, some of our residents that have eye drops that they must take every single day, including weekends, and it's just too hard for them to manage if they have arthritis. Our nurses do those on the weekends. So we actually have a home support nurse on call as well on the weekends. Yes. So they can start cases on the weekend if need be, and they can provide that assistance, whether it's wound care, medication administration, things like that. So we have lots of options. And then that is generally paid for privately out of pocket. Or if you have a long-term care insurance policy, you can use that to pay for home support services after you meet all the criteria for your individual plan.
And that is so varied, right?
It is very
all
varied.
These different insurance plans.
It is. We have a whiz down in home support that knows all about that. His name is Gary Lebecki, and he's been on several times. But if you have a question about your policy as to whether or not it's going to work with home support and you're thinking about signing up, just give us a call on home support, and we can have you set up an appointment with Gary. Occasionally, if you can't get out, Gary's even gone up to an apartment to help explain it. We'll talk to family members, whatever we need to do.
That's really good to have somebody who can decipher insurance speak for you.
He is wonderful, and he makes sure that all the documents get submitted to your long-term care insurance timely, because every company has a different requirement. And so he's pretty well versed in what all of those are, and he sends off the information so that everyone gets reimbursed and it's not an issue.
And how much of a lead time do you need to get somebody on board?
It really depends on the hours you're looking for and what kind of care. So right now, I like being transparent. Right now, the morning hours, which are the most popular, generally from like 7 to 11, we don't have a lot of room right now. And it's understandable. People want assistance getting up in the morning, getting showered, dressed.
Getting the day going.
So we're always hiring for those hours, no matter what. We have a lot of availability after like 12, 1 o'clock, all the way through close to dinner time. So if someone wanted some general help around the house or companionship, we have tons of availability during that time. If you want to start on a weekend, it really just depends on what's going on and what the staffing looks like. But we have, we've been able to take most of what's come our way lately, which is a blessing.
Yeah, absolutely.
Yeah.
So no long wait to be expected.
No, we try to get in there as soon as we can. Generally, our cases have to open with a nurse doing an assessment. But while that nurse is doing the assessment, our great schedulers down in home support are looking for an aide that can come in as soon as that assessment is done and the care plan is made. So they're working on both at the same time.
So home health and home support. Do you have one phone number for us residents to call if we have questions?
They have two separate phone numbers.
Oh, okay.
So home health's phone number is 604-3123 if you're calling internally, and home support is 604-4677.
Okay,
And now,
clearly different. I'm glad, not just one digit different.
We're all in the same office, however. So if you call one and you get the wrong one, they send it the right direction.
Well, and you talk to each other, I'm sure.
Constantly, We're all down in the resident life department in Forest View on the terrace level.
Which we now all visit because we go to the fitness center.
It is
which
awesome
is
to
across
have
the
them
hall,
there.
right?
Yes, we get more foot traffic. People are constantly peeking in to see who we are now, which is wonderful.
I bet. Now, what do you do as the home care administrator in all this?
So I manage the day-to-day operations of both businesses, the financial, marketing. I manage the managers that manage the staff. I go to meetings and communicate with the rest of the community and our corporate partners up in Maryland. But I'm also an RN, so I get pulled into things occasionally. And I provide support to the managers. Like right now, home health, we are blessed to have a traveling clinical manager from corporate while we're on the hunt for a new one. So I provide her support because she doesn't know everything about our community. She travels to all of the different Erickson communities, so kind of helping her.
That's great.
I know the residents, so I provide her with background information. And then I also sit on the ancillary Health Services Committee, and I work with them to help promote both business lines and promote awareness. And one of the things that we're doing to promote that is in October, on the 30th of October in Hunters Crossing Conference Center, we are holding a expo of sorts, basically like a healthcare expo that also provides information on support groups and activities that would help you promote your wellness.
So it's an expo for the residents?
For the residents from 1 to 3. You're going to be getting a flyer in your cubby towards the end of September. And not yet. No RSVP needed. If you want to, you can. There's a number, but at your own pace, walk the expo, get the information, and then go home. You don't have to sit through a whole presentation. So
good. That sounds very convenient. It's a little bit away. It's right before Halloween, but we'll get back to that when we get there. For now, we're done. Our time is up, and I think we got everything in that we wanted. Thank you so much for coming here, Christine.
My pleasure.
And thank you for spending the last half hour with us.